Hi, this is Dr. Singer Reddy from Empower Psychiatry and Sleep. How can dark therapy be useful to improve sleep in bipolar disorder? Bipolar disorder could often be triggered in terms of either mania or hypomania or depression with poor sleep. In fact, there have been studies where they looked at using dark therapy in somebody who's going through rapid cycling bipolar disorder or is in an acute manic phase. In them, creating an environment where they are potentially in a dark place or sleeping for 14 hours out of 24 hours seems to improve symptoms of both mania, sleep quality, as well as hypomanic symptoms. If you are struggling with sleep disturbances and has underlying bipolar disorder, it is probably prudent to consider dark therapy during those phases. What you would do in order to get this kind of intervention is to minimize light exposure starting from the evening hours till you wake up in the morning. Assuming you typically wake up around 8 o'clock in the morning, you want to start dark therapy somewhere around 8 or even earlier. What you want to do is minimize exposure to any bright light, particularly overhead light. Keep the lights dim. Use either table lamps or low light in order to facilitate any activity that you want to do during the evening or before bedtime hours. Also consider using blue light blocking glasses, which would minimize exposure to blue light, which seems to be the main triggering type of light in these cases. If you are attempting to go to bed around 10 o'clock, you want to minimize exposure to any kind of digital light. If needed, use blue light blocking glasses. Consider using blinds that darken your room pretty well, particularly your bedroom, in order to minimize any other external light exposure. Anything you could do to minimize light exposure, specifically blue light exposure, seems to help create an environment that could potentially improve not only your sleep quality but also indirectly benefit the underlying bipolar disorder symptoms. Again, this is Dr. Singer Reddy from Empower Psychiatry and Sleep. Thank you very much.